everyone, it's me, your girl, Mercy Nelson. I'm a physiotherapist. Today, we'll bring the very first of our series of public health enlightenment and advocacy. Our topic for today is on the benefits of responsible care in the elderly population. As we all know, aging comes with a lot of diseases, and among the leading causes of death in Nigeria today are the complications of hypertension and diabetes, while others include malaria, tuberculosis, infant and maternal mortality, hepatitis, HIV. Our conversation today is centered on the holistic approach in preventing and delaying the complications from these chronic diseases. Complications of this hypertension and diabetes are stroke, blindness, erectile dysfunction, amputations, kidney failure, heart diseases, and infections. These complications can be prevented or delayed if responsible care is given to this elderly population, and I'll tell you how. For instance, managing stroke and kidney diseases are very burdensome that poses huge psychological and financial involvement both to the patient, to the family, and to the caregivers. For example, a stroke patient may need about 150,000 naira and above for just their basic drugs, physiotherapy care, and other medical interventions, while patients with kidney failure may need dialysis on a weekly basis, which will cost nothing less than 200,000 for dialysis and other interventions, and possibly kidney transplant. These are very expensive procedures. So I would urge all of us to take good, responsible care for our elderly population to avoid this. So, what are the challenges to early diagnosis and prevention of complications? 1. Access to credible health information. 2. Access to health facility. 3. Economic or financial issues. And the fourth one is health caregivers. To buttress this, in access to credible health information, we are talking about lack of information, misinformation in the social media and general community, activities of quacks and religious belief have cost so many people their lives. Ensure you speak with a certified and a credible medical personnel about your health. Remember, not be everybody where they work for hospital now doctor, some of which are cleaners, hurdlers, records officer, and so many others. 2. Access to health facility. Our health institutions are weak, stressed, and understaffed. We have various communities that do not have any health facilities, either public or private. Government is not responsible enough, not doing enough. Hence, we have to do more for ourselves. 3. Economic issues and poverty. In many cases, people refuse to attend to their health and take proactive steps to prevent complications. This is also due to poor funding and health inequality. Almost all our ex-governors, presidents, enjoy foreign health insurances even after their massive looting. But the shabby health insurance that is being offered to the average citizen could hardly benefit good coverage. Still, a poor patient can still have a good care if we are more committed to one another and be more responsible to the health of our aged population. So what are the roles of the family? Take a closer look at this issue. For instance, a man fell during a family meeting and a witness called the kids to arrange for his care. The kids called back and said their dad was not sick. After 1 year, the man died of heart disease. These are the children with great education living in the cities. Are they responsible? I leave that to you in the comment section to drop your answers. In another case study, a middle-aged woman died of kidney failure and the kids blame their father for the wife's sickness and death, citing poor care. Can the grown-up kids be exonerated in this? I look forward to your answers also in the comment section. Responsible family support can help in early detection of these diseases, delay complications, improve lifespan, and even boost their overall quality of life. People living with any of these chronic conditions do not have to face discrimination. I know of a man who even maltreated his wife due to diabetes. Efforts must be made to ensure that drugs are taken as prescribed. Patients may not get all the prescribed medications from the hospital pharmacy due to funds, stockouts, and even exhaustion. Caregivers must see that the missing drugs are completed from a reliable community pharmacy premise. In fact, I would advise that the caregiver should rapport with a nearby community pharmacist for drug information, counseling, refilling, and issues properly not relayed in the hospital. The hospital pharmacists in Nigeria setting do not do much for the patient beyond handing them their medications through a small opening. Caregivers should involve the community pharmacist in the healthcare team of their aged patients. The community pharmacist can also help in brand selection if the burden of bills becomes unsustainable. Oftentimes in our hospitals, patients are prescribed brands not based on the need and affordability. The community pharmacist can help the patients with the dose monitoring and calculation, evaluation of side effects and other symptoms of overdose. This does not rule out the routine attentions in the hospital. So therefore, caregivers must remind and assist the patients for their appointment day and hospital visitations. Family members are the major caregivers in our society, unlike in the advanced countries where we have licensed caregivers and facilities paid for the purpose of this service. If the work is much, they should hire an auxiliary nurse who can attend to them personally at home or in the hospital. I also know of a young man who routinely takes his parents to the city for their medical checkup and evaluation. This old man that is over 75 years old is a known diabetes and hypertensive patient, but has no complications and thrives well in a remote village where there is no health facility. The proud son rapports with doctors nearby in case of urgency and ensure that all the medications is supplied to the parents quarterly. He sends the quoted amount to a trusted pharmacist who knows his father's medical history. The drugs, monitoring devices, and other supplements are also delivered alongside these medications. And this old man is bouncing, strong, and doing well for himself. That is a responsible son. He never waited for others. He did the right thing, not just sending stipends and yearly bag of rice. Okay? Take notes. In summary, to prevent or delay the complications of these chronic diseases and ensure good old days devoid of pains and sickness, family caregivers must play their major roles. These roles, as detailed earlier, helps in early detection of diseases, monitoring and compliance to this drug lifestyle.